Hey everyone, I'm Ava, and in this video presentation, we will be discussing information regarding mental health and homeless youth. The previous notion that homeless people are problematic or bad seeds tends to persist, but homeless youth come from every background and culture and become homeless for several different reasons. There is continuous misunderstanding of why and how this happens. Adolescents make up about a quarter of the total homeless population. Depression is the condition mostly observed in homeless youth, and it is seen in this population more than 6 times than in youth who are not homeless. Additionally, as many as 25 to 45% of homeless youth have attempted suicide at least once. These statistics give insight to the severity that is poor mental health in homeless youth. It is estimated that anywhere between 750,000 to 2 million young people experience homelessness in a given year. As mentioned before, youth can become homeless for many different reasons. Commonly, these youth are fleeing from physical, verbal, mental, and sexual abuse. Often there are combinations of these forms of abuse. Additional reasons for homelessness are school conflict and economic hardship. Sometimes, youth are kicked out of their own homes with nowhere to go and no way of supporting themselves. Particularly prevalent in this population are anxiety and mood disorders, one of the most common being post-traumatic stress disorder, which is experienced by about 25 to 30% of homeless youth. Another common disorder seen in this population is major depressive disorder and bipolar disorder, which are both experienced by about 40% of homeless youth. It is notable that many of these youth meet criteria for multiple diagnosis. One study demonstrated comorbidity in about 76% of the homeless youth population. Unfortunately, it is not surprising that many homeless youth have or has had suicidal ideation, attempts, or completed suicide. This is often a result of the comorbidity of mood disorders, traumatic pasts, and current life situations. Some studies link an increased risk for suicidal ideation and attempts with a decreased resilience in homeless youth. Resilience allows for someone to thrive in the face of adversity with self-efficacy and an action-oriented approach. Research shows that those, such as homeless youth, are prone to be less resilient than housed youth, having some effect on their thoughts and actions, leading to an increased risk for suicide attempts. Commonly seen in homeless youth is an increase in substance use compared to housed youth. They are 2 times as likely to engage in substance use, possibly as a coping strategy. Currently, about 88% of this population uses at least one substance. One pattern demonstrated by research indicates that the longer the period of homelessness, the higher the rate of substance use. The growing substance use problem in homeless youth has significant impact on mental health, leading to more cases of anxiety, depression, and engagement in high-risk behaviors. Many of these vulnerable adolescents lack enabling factors such as supportive family and friends, insurance, and case managers. Without these things, homeless youth are left to fend for themselves, often having no knowledge of sources of help or even access to those sources. Not only do these sources serve as a great help in the area of mental health, but in other areas such as medical and dental care, foster care, and food and clothing. The absence of enabling factors prevent homeless youth from using outpatient services and engaging in continuous care, resulting in persistent poor health outcomes. In order to lessen the negative impacts of homelessness on affected youth, intervention strategies have been implemented. Many homeless children lack access to mental health services or any services at all, and some organizations want to do something about this. One approach is to take a politicized view of the trauma experienced by these youth, and to cater community services and interventions to their specific mental health needs. Other intervention strategies include family intervention, if possible, and homeless shelters. We even have some local resources here in Gainesville that can provide relief for the homeless population. I volunteer with Equal Access Clinic Network to provide free primary care to uninsured and underserved populations in the community. We often are able to see patients who may be homeless and offer the care they need at no cost. Additionally, Equal Access offers mental health services to all patients, which can be utilized by homeless adolescents if needed. Another well-known resource is Grace Marketplace, which provides shelter, food, case management, and job training to anyone experiencing homelessness. Some services offered at Grace Marketplace include medical services, veteran services, and mental health services. This presentation will end with questions to help you think about this topic on your own. In Gainesville, there are often homeless people around campus who are ignored by students and faculty walking and driving to class. What are practical ways to help these individuals feel like people rather than objects? Why do you think homeless people are ignored? Why do you think homelessness has been prevalent for so long, and is there a solution to something this big? Why or why not? Thank you.